Okay, so that is the summary of dyspnea. Difficult breathing. Then you look at the classification. Here we are using the New York Heart Association classification of dyspnea. Then the commonest causes, we have respiratory system and cardiovascular system. And then we're saying that dyspnea, it has a complex pathophysiology, but it is related to carbon dioxide, increased carbon dioxide concentration and reduced oxygen saturation. Okay. Then so we have to look at what diseases under the respiratory system are going to cause dyspnea. And then when we look at CVS, also what diseases under CVS are going to cause dyspnea. Okay, so let's look at chest pain. Now, when you are looking at chest pain, okay, when you're looking at chest pain, it's very important to use this mnemonic. I think I talked about it, called Socrates. Okay, so when a patient presents with chest pain, right, you need to know the site of the pain, on which part of the chest is the pain. Okay, someone said, I'm having chest pain in my head. Ah, how? Okay, so you have a site, then onset. When did the chest pain start? Then you look at the character. Is it sharp pain? Is it dull pain? Is it throbbing pain? And so on. Then you look at radiation. All right. Radiation, that is also going to give you ideas of what may be causing that pain. Okay. For example, pain that is radiating to the left shoulder and the neck may be due to angina. Okay. Then we have timing. Okay, the pain is worse at specific times. All right. Then you also have exacerbating factors and relieving factors. Then you also have severity. So you consider that mnemonic Socrates. Okay. So what are some of the causes of chest pain? Causes of chest pain, we can have one. We can have malignancy. Okay. Malignancy is one of the causes of chest pain, such as lung cancer, right? Then we can also have infection. Infection in cases of things like TB, bronchiectasis, as well as pneumonia. Okay, TB, pneumonia, and bronchiectasis. Right? Then we can also have things such as pneumothorax. Pneumothorax. Okay? Pneumothorax. So those, and then also vascular causes. Okay? Vascular causes. Vascular causes such as pulmonary embolism. Okay? Pulmonary embolism, as well as pulmonary infarction. Okay, pulmonary embolism and pulmonary infarction, those are going to cause chest pain. Okay, other systems, for example, can have CVS causes. CVS causes of chest pain. We can also have musculoskeletal causes of chest pain, as well as GIT causes of what? Chest pain. Okay, so those are the causes of chest pain, right? Then let's look at wheezing lastly. Okay, last we look at wheezing. So let me go through that once more. Chest pain, all right. So we're saying that the pain is primarily originating from the chest region, from the chest wall. Now you should always remember that the chest has both the anterior part and the posterior part, right? So when you say chest, you are not only considering the anterior part of the chest. Okay. Now, always consider that mnemonic, Socrates. You need to know the site of the pain. You need to know the onset, when did it start. You need to know the character of the pain. You need to know the radiation. Is the pain being transferred or rather referred anywhere else in the chest? Then you also want to know the associated signs and symptoms. Is this pain also associated with dyspnea, for example? Is it also associated with cough and so on? Is it associated with wheezing? Okay. Then you look at timing. When is it worse? Is it worse at specific times of the day or at specific times of the week? I mean, days of the week. Then you also look at exacerbating factors and relieving factors. What makes the pain worse and what makes the pain reduce? Then you look at the severity. Okay, severity, it depends on the patient that you're dealing with. If the patient is literate enough, you can give them a scale. Maybe in the scale of 1 to 10 or 0 to 10, what is, how would you grade your pain? Or you can ask them, is that pain limiting them from doing certain things that they normally do? Are they able to walk? Or are they waking up at night because of the pain? Or are they even not able to go for work and so on? Then you'll be able to know how much of the pain they're experiencing. Then the causes, you have malignancy such as lung cancer. Then we also have infection. We also have pneumothorax. We can also have vascular causes. Okay. We can also have vascular causes such as pulmonary embolism and pulmonary infarction. Then we also have serious causes, musculoskeletal causes. For example, under musculoskeletal causes, we can have costochondritis. It's going to cause chest pain. All right. Then we also have GIT causes. All right. Then after that, let's try to look at wheezing. Look at wheezing, and then we're going to be done for today. Okay. Now, when you look at wheezing, basically, it's an abnormal sound that is produced when breathing. It's like someone is laboring to breathe, right? And then there's that abnormal sound that is being produced. It is, you can hear the sound. Okay, you can hear the sound even without using a stethoscope. Okay. Now, what are the causes of wheezing? The causes of wheezing are going to look at asthma. It's the commonest, it's one of the commonest causes. Okay? Foreign body is going to cause wheezing. Okay? And then we also have COPD. Now, COPD, of course, is more common in the elderly. Right? COPD is more common in the elderly. Okay? Now, on this, we can also look at bronchiolitis. Okay, this one is more common in babies. Okay, in babies, especially below the age of 2 years. All right. Most of the times, it's quite difficult to diagnose asthma in children below the age of 2 years. Okay, but the more common one, which is similar to asthma, is bronchiolitis. Okay. Then we can also have bronchiectasis. All right. Then we can also have allergies. Okay, allergic reactions. All these are going to cause what? They're going to cause wheezing. Okay. Even bronchitis, by the way, bronchitis can also cause wheezing. Okay. So these are the respiratory symptoms that you're going to have, that patients are going to present with. All right. And then remember, we also talked about the other causes. I mean, the other symptoms, which we call constitutional symptoms, like fever. Fever may be present in things like TB, in things like pneumonia, Even in lung cancer, you may find a fever. Then you can also have hoarseness of the voice, especially in cases of cancer, lung cancer, where the tumor is compressing on the recurrent laryngeal nerve. Then you can also have night sweats. Night sweats are more common in cases of TB, as well as in cases of pneumonia, as well as lung cancer. Lung cancer, we can also have these night sweats. Okay, so this is basically about respiratory system taking. All right. So now, what is important is that after you take this history, you need to come up with a list of differential diagnosis, right? You need to come up with that. So, like I mentioned earlier, as you are asking those questions, whatever questions you're asking about these symptoms, you are eliminating some of the differentials that you had. Remember, when a patient just comes, okay, they come in your mind, they have potential to have any particular condition, in this case respiratory condition. Okay, now as you begin to ask questions, okay, as you begin to ask questions, you are going to be eliminating these conditions, I mean these things. Now let me try to connect with what we discussed under presenting complaints and history of presenting complaints, right? So a patient comes with cough, okay? So you ask the patient, what has brought you to the hospital? Why are you here? Why have you come to see the doctor? And then the patient says, I'm coughing, okay? Patient says, I'm coughing. The next question that you're going to ask is, when did you start coughing? Because remember, when we talked about presenting complaints, you need to know the symptom and the duration of the symptom. So when did you